That's because visceral fat is hormonally active and metabolically active. So what does that mean? Visceral fat can secrete inflammatory markers, different cytokines, fatty acids, and hormones that interfere with the rest of the biology of our bodies. The cells that make up visceral fat are usually larger and more insulin resistant as opposed to the cells that make up our subcutaneous fat. They are smaller and very insulin sensitive. And both types of fat, they respond in different ways when it comes to catecholamines like epinephrine, hormones like cortisol, estrogen, testosterone, and those hormones are going to influence how that fat is either broken down or accumulated. Welcome to No Filter Doctor, where we cut through the health hype, dig into what's real, what's backed by evidence, and what works. I'm your host, Dr. AK. Let's get into it. Hey everyone, welcome back. Thanks for joining me. This week, we are going to talk about visceral fat. Some of you may not have heard about visceral fat, and that's okay. It's not very well known, but it's important to know about it because you can have a normal weight or ideal weight and have an elevated visceral fat. It's different from subcutaneous fat, which is what most of us know about. The other issue with visceral fat is it is metabolically active. So today I want to talk about what is visceral fat, how is that different from subcutaneous fat, and what are all of the other things that we need to know about it and what it can do, and more importantly, how do we figure out what ours is, and then what strategies can we use to lower ours if it's elevated. Visceral adipose tissue is fat that is stored behind the peritoneal cavity. So if you take your fingers and you push it into your belly, you're eventually going to reach a point of your belly where it's firm, it's less squishy. It's behind that visceral fat gets stored. It can go into the mesentery, it can go around different organs, and it can actually start to infiltrate organs. Subcutaneous fat is the fat that's stored right beneath our skin. So that's kind of like if you pinch your belly or maybe your love handles or whatever, and you're able to pinch some tissue there in between your fingers, that is subcutaneous fat. Subcutaneous fat is the primary site for storage when we have caloric excess. It also serves as insulation for our bodies. Once the storage capacities of that subcutaneous fat are exceeded, that is when the body will then choose a visceral location to store any additional fat tissues. So that's when we go into the peritoneal cavity, which is what that part of the abdomen is called that stores all of your organs. And while that visceral fat does serve as some cushioning for the organs, it is a totally different beast from the subcutaneous fat. That's because visceral fat is hormonally active and metabolically active. So what does that mean? Visceral fat can secrete inflammatory markers, different cytokines, fatty acids, and hormones that interfere with the rest of the biology of our bodies. The cells that make up visceral fat are usually larger and more insulin resistant as opposed to the cells that make up our subcutaneous fat. They are smaller and very insulin sensitive. And both types of fat, they respond in different ways when it comes to catecholamines like epinephrine, hormones like cortisol, estrogen, testosterone, and those hormones are going to influence how that fat is either broken down or accumulated. While the primary contributor to the accumulation of visceral fat is caloric excess, there are a bunch of other variables that are involved that determine where is that excess fat energy going to be stored. Some of the biggest drivers are lifestyle factors. So things like, again, nutrition and how many calories you're eating, right? We have that caloric excess. There is evidence that if you have less than 5 to 6 hours of sleep consistently, your body will prefer to store any kind of fat excess in a visceral location. And the other thing is exercise. People who are sedentary, they tend to have more visceral fat accumulation. Age and sex also play a huge role in visceral fat accumulation. In general, at any BMI, men have a higher amount of visceral fat compared to women. Men tend to accumulate visceral fat when they are younger. Women start to accumulate visceral fat right at around their mid-40s, and it's no coincidence that this correlates with a very common age of perimenopause and menopause. From the time people go from their 30s to their 70s, men accumulate about 200% of visceral fat compared to what they were before their 30s, and women are at 400% compared to where they were before their 30s. And for women, that peak that occurs at about the mid-40s, every year thereafter, there's about a 6% increase in visceral fat accumulation. Now, hormones also heavily influence visceral fat accumulation, but it is really complicated. Depending on someone's metabolic state, their activity, again, age, sex, other underlying medical conditions, some of these hormones can work synergistically. Sometimes they counteract one another. We do know that excessive cortisol, not functional excessive cortisol, I'll get to that in a second, but excessive cortisol, like in the setting of Cushing's disease, promotes visceral fat accumulation. And the problem with that is visceral fat also promotes cortisol. So it's kind of like this positive feedback loop where cortisol causes the accumulation of it. And then it's like, hey, I'm just going to make some more and, make myself bigger. Now, the reason that I emphasize Cushing's disease is because that kind of high level of cortisol is a totally different beast from what's called functional hypercortisolemia. And so the thought is, if we have chronic stress or other things going on in our lives, we know that cortisol can go up. What we don't know is, does it go up enough to do anything like it would in the setting of Cushing's disease? Is there any clinical significance to this? And the answer so far is we're not entirely sure. We think probably not, just because a lot of the data right now is very mechanistic data, and there's not a lot of clinical trials to look at in people to prove it. But again, data changes. Science changes, so who knows what we're going to find out in the future. Testosterone is an interesting one. It inhibits visceral fat accumulation in men, but promotes visceral fat accumulation in women. For women, estrogen is what is typically protective of visceral fat. In the presence of estrogen, women will tend to store fat in the subcutaneous areas. But then once those amounts of estrogen start to deplete, you'll notice that you start to gain weight in your midsection. And this is something that I have talked to with so many of my patients, and it is typically a function of that estrogen. Those levels are low, and so now we have visceral fat accumulation instead of that subcutaneous fat where the fat went to all the other places throughout our body. There may also be a link to visceral fat accumulation and your microbiome. Now, this is a corollary relationship. There's no causation established here. All we know so far is that if you have a microbiome that is highly diverse, you tend to accumulate more subcutaneous fat. People who don't have a very diverse microbiome, they tend to accumulate more visceral fat. But again, we don't know why. We don't know what the exact cause is. We just know this pattern exists. Genetics and ethnicity is also huge. Asian populations tend to store more visceral fat just based on their genetics. This is the population that's notorious for having a normal weight, a normal BMI, and then you do a body composition on them and their visceral fat is way out of proportionately higher compared to the rest of everything else that's going on in their bodies. And this is one of the main reasons why I say BMI is completely insufficient when we are looking at someone's metabolic health. All right, so now that we know about visceral fat, how do we measure it? Gold standard is a CT scan or an MRI. Both methods are capable of identifying visceral fat, but the other thing that they're good at is identifying ectopic adipose tissues. So like I said, visceral fat accumulates inside the peritoneal cavity, right? Inside your abdomen. But the other thing that can happen is you can then get fat deposits in and around specific organs. And we know that depending on where these fat deposits go and which organ they're at, we can have increased risk for other disease processes, which we're going to cover once we're done with how do we measure it. So the next test that you can use is something called a DEXA scan. That stands for Dual Energy X-ray Absorptiometry. That's very hard to say. I'm not even sure I said it right. That last word. The first three were easy. This is a very validated method of measuring visceral adipose tissue. Another form of technology is called bioimpedance. And so what happens is a low current of electricity travels through your body, and then based on the impedance and resistance measurements, the machine is able to determine which part of this is muscle, which part of this is fat. Bioimpedance is actually really good at telling you what's muscle and what's fat. It's very comparable to a DEXA scan. However, it's not that great at visceral fat. And the reason for that is it's not exactly a direct measurement. What's happening are regression equations are being used. And then based on additional data of someone's sex and age, math gives you the answer to the question rather than it being a direct measurement. The good thing about the bioimpedance machines, however, is they are very fast. They are not expensive studies to get, and they are accurate over time. So when we get a measurement, that exact measurement may be off, but the trend that it demonstrates is not. If you have increasing amounts of visceral fat or decreasing amounts of visceral fat, bioimpedance captures that very well. And when I'm talking about bioimpedance, I'm talking about the commercial machines that you have to go to a place to get a measurement from, not the scales that are available at home. The scales that are available at home typically only have 2 points of contact on the feet. The commercial ones have more points of contact. And the ones that have the additional probes that go on the abdomen, they're even more accurate. The least expensive and most repeatable of all of these is waist circumference measurements. And this is typically what's used in a lot of studies that wants to look at interventions to decrease amounts of visceral fat. It acts as a surrogate for that visceral fat volume. Now, obviously, a waist circumference measurement is also not going to give you the exact amount of visceral fat because there's no way to determine what's making up that abdominal girth. Is it subcutaneous? Is it muscle? Is it visceral fat? So again, this waist circumference acts as a surrogate. All right, let's switch gears now and talk about some of the health outcomes that are associated with visceral fat. In general, the higher amount of visceral fat you have, the poorer the health outcomes are. High levels of visceral fat accumulation are associated with lipid abnormalities, usually a hyperlipidemia, high triglyceride levels, certain cancers, and chronic inflammation. I briefly mentioned the ectopic adipose tissue. That's the fat that gets deposited in and around organs. So just like visceral fat tends to accumulate whenever those subcutaneous fat levels are overwhelmed, that ectopic fat deposition tends to occur whenever the visceral adipose tissue volumes also start to become overwhelmed. And the reason this is a big deal is because fat around the heart is an independent predictor of cardiovascular death. There are also more heart failure hospitalizations and major cardiac adverse events such as heart attacks. Fat deposited around the kidney is associated with chronic kidney disease and poor renal function. Fat deposited in the liver is the strongest predictor of insulin resistance, impaired glucose regulation, and metabolic syndrome. Pancreatic fat depositions demonstrate similar effects to those that are from the liver. The other thing that's a concern is whenever fat deposits into an organ, it can lead to organ failure. Non-alcoholic steatohepatitis, which is abbreviated as NASH, is one of the fastest growing causes of cirrhosis, and in some cases, liver transplant. So it's really important to know what is the visceral adipose tissue level. That measurement matters. And while I would love to give you some answer on this is the ideal amount, I can't really do that because that is very dependent on all those other factors that we talked about before, like age, sex, ethnicity. Too many variables that are involved, but I can give you some general rules. 100 centimeters square, that's the volume that we're measuring. that or anything above it has a higher incidence of having poor health outcomes. That's where the insulin resistance, metabolic disease, and a lot of the other problems that I just talked about start creeping in. But again, they're not completely reliable. There was a study done by the NHANES survey. We've talked about NHANES in the past before. That's a survey that goes out to people living in the United States every couple years, and they answer all these questions. And what that study data demonstrated is that it is variable at what threshold people will start to develop different medical issues because, again, of their age, sex, ethnicity, activity, and other lifestyle factors. The range goes anywhere from 70 to 166 centimeters square. 70 is not that high. There are also thresholds for waist circumference. In non-Asian populations, it's 35 inches or greater or 88 centimeters or greater in women and 40 inches or greater or 102 centimeters or greater in men. In Asian populations, that decreases to 80 centimeters or greater for women and 90 centimeters or greater for men. It's once we start to reach these thresholds that metabolic syndrome, insulin resistance, and a lot of the other disease states that I discussed become a concern. So how are we going to reduce these visceral fat levels? Let's say we go get a measurement, ours is elevated. What do we need to do now? Well, there's two columns of interventions. One is lifestyle interventions, and the other one is with medical assistance. The lifestyle ones, I hate to break it to you guys, but it's kind of like the same thing that I talk about all the time. One of the biggest ones is exercise, specifically high-intensity interval training. As little as 400 metabolic equivalent task minutes is needed. That's like a 20-minute HIIT workout. You can also reduce visceral adipose tissue with other forms of higher intensity cardiovascular exercise, but you have to work out for a little bit longer because you're looking for about 1,100 MET minutes per week. There was a study that demonstrated 3 sessions of aerobic training per week, anywhere from 12 to 16 weeks, was capable of reducing visceral adipose tissue levels. The other lifestyle factor is your nutrition. What are you eating? I will tell you right now that there is no diet that has come out so far that reigns supreme in reducing visceral adipose tissue. The Mediterranean diet is the one that is the most well studied. And yes, there is evidence that if you follow a lower calorie Mediterranean diet, you will significantly reduce the amount of visceral fat. There have been a bunch of studies that compare low carb versus low fat. Some show that a healthy low carb diet may have a higher significance. Others show that there's absolutely no difference. Intermittent fasting and time restricted eating can also reduce visceral fat, but there's an important caveat that we need to discuss. When we're talking about intermittent fasting or time restricted dieting, the main net effect of this kind of diet is reduced caloric intake. So when you compare that same caloric amount, whether it's obtained through fasting or just regular meals throughout the day, there really is no significant difference. The one thing about diet that we do notice makes a difference when it comes to visceral fat accumulation is what the quality of the food is that you're eating. And I'm not talking about organic versus not organic food. I'm talking about, is it low in energy and high in nutrients? So diets that have a lot of highly refined sugars, have high fat intake, and have low fiber, they tend to promote visceral fat accumulation. The converse of that is diets that are rich in polyphenols and dietary fiber, things like fruits, beans, vegetables, and other plant-based foods. Those are associated with a lower amount of visceral fat accumulation. What we don't know is what's the magnitude, like what amount of those you have to eat. Does that suggest or predict what the visceral fat accumulation is going to be? We don't know those details. I mentioned before sleep is an issue. So you want to try and get more than 6 hours of sleep a night. Now, sleep isn't going to have the same kind of impact as diet and exercise, but its impact is really more of a preventative one rather than a, oops, I'm here now, I need to fix this somehow kind of one. And then stress. And the reason I put this last is, again, we get into that whole debate of whether this functional high levels of cortisol do anything or not in terms of long-term visceral fat accumulation. So the thought is that if you have really great coping skills for your stress, that perhaps you will have a lower amount of visceral fat accumulation. But I'm going to tell you right now, the biggest bang for your buck in terms of the lifestyle modifications comes in the form of the high-intensity interval training and eating the proper foods. That's where you're going to be able to have the highest impact through lifestyle modifications. Now, there are also medical interventions that can reduce visceral fat. Retatrutide is a GLP-1, GIP, and glucagon receptor agonists, and studies have demonstrated a huge impact on decreasing the amount of visceral fat. Other GLP-1s have demonstrated the same effect, as has bariatric surgery. Hormone therapy is another possible intervention in the right patient population. So obviously, if women have depleting amounts of estrogen, if they are a candidate for estrogen replacement, that may help with the visceral fat accumulation. Same as testosterone in men. But again, you have to be a candidate. You have to look at the big picture. You have to see what else is going on with that individual. So I'm not putting out a blanket statement that these are the right things for everyone. So that's kind of all the stuff you need to know about visceral fat. If I have to highlight a few key takeaways, it's going to be that one, visceral fat is an entirely different beast than the subcutaneous fat, and everybody should absolutely get their amount measured. BMI or a standard number on a scale are not enough. You want that visceral fat measurement because you need to know that in order to know what your risks are for all the other things that we've talked about. And I think people should use whatever they have access to. If you have access to MRI and CAT scan, which are gold standard, you have the money, you're able to get it done, or your insurance will approve of it, sure, do it. If you have access to bioimpedance at a doctor's office, do it. If you want to use waist circumference or use the home scale, do it. What's going to be the most important is not only that number, but how it's trending. So while some of those numbers may not be 100% accurate, you know the general thresholds and you know what you need to do in order to trend in the correct direction. And all of those studies are capable of providing that data. The best approach to visceral adipose tissue is maintaining a lifestyle that prevents the accumulation of it in the first place. And obviously, this gets harder as we get older. You know, we're in our 20s. We can do whatever we want, eat whatever we want, maybe work out, maybe not work out. And most of us are going to be great in terms of visceral adipose tissue. However, things start to change as we get older. And with those changes, we have to make lifestyle modifications to prevent additional accumulation of visceral fat. I have so many patients who are asking me about stress and cortisol and measuring their cortisol level or what supplements they should be taking for visceral fat. And my answer is there is no evidence that any of those definitively are going to do anything. However, we do know definitively that exercise and nutrition are going to have a huge role. So I would put most of my energy in making small, tiny changes in those areas. And then once you've done that, once you've optimized those, and there's really not much more you can do within reason to improve them, then we can start looking at this other stuff where the data is like, maybe. The bottom line is this is one of the most modifiable risk factors for disease. So let's do it. It's kind of a no-brainer to put the work into those to promote a healthier life. As always, I would love to hear from you. If you have anything on your mind, any topics that I haven't covered yet, please send me a message. I'm always looking for inspiration. And with that, I will talk to you next week. Take care. Thank you so much for joining me on this week's No Filter Doctor. If you enjoyed the content, you can follow me on social media. I'm on Instagram, Facebook, and YouTube. You can also go to www.thewholehumanhealthandwellbeing.com and sign up for the weekly newsletter where you will get a link to the blog, that week's podcast, and a health tip of the week sent directly to you. It's important to know that while I am a doctor, I'm not your doctor. This podcast is for educational and informational purposes only, and it's not intended as medical advice. Listening to this podcast does not establish a doctor-patient relationship.
The information discussed should not be used to diagnose, treat, or prevent any medical condition, nor should it replace individualized medical care. If you have questions or concerns about your health, please contact your own healthcare provider. Any decisions to delay or forego a medical evaluation or treatment based on the information discussed in this podcast are made so at your own risk. My only financial disclosure is my medical practice, the Whole Human Health and Wellbeing. Take care, and I'll talk to you next week.